As part of the celebrations of the NHS turning 70, I wanted to share the experiences of my grandparents working in the NHS. My grandma Lillian Jordan is 91 and for 30 years she worked as an auxiliary nurse at Redeford Hospital in Nelson. She was offered a job when visiting a patient as they were short-staffed on the ward. Her starting pay was £0.50 an hour and her duties consisted of taking temperature, blood pressure, washing patients, sorting bedpans and changing beds. She loved her job and my granddad used to say she was paid for doing her hobby. Redeford Hospital was originally a private house built in 1892 that was converted into a hospital with additional buildings added in the 1930s and 40s. Unfortunately, it stood in the path of the M65 and was demolished in 1987. Lillian took retirement when the hospital closed, but still meets with some of her former colleagues at Christmas every year, 30 years on. My granddad, Rennie Jordan, passed away 6 years ago, but the last 10 years of his working life were spent working as a porter at Burnley General Hospital, before retiring in his early 60s due to ill health. He also loved his job and often said he wished he'd started working there years ago. Both Lillian and Rennie benefited from NHS healthcare, which helped to improve the quality of their life in later years. Rennie had a triple heart bypass in his early 70s, which allowed him to continue to pursue his passion for golf, and Lillian had extensive treatment to help preserve her eyesight due to the effects of macular degeneration. Including myself, we have 56 years of NHS work between us and are very fortunate to have had jobs we love, which contribute towards improving the health of the local population.